Hello guys, welcome to Dr. SNK channel. So I'm back with the day 7 questionnaire, that is yesterday's I forgot to upload. So seeing the questionnaire to be uploaded, that was on the 29th March 2025. So what does it say? Read the history properly. A 43-year-old comes to the OPD with history of fever and there is a lesion, skin lesion. And how is that skin lesion? It is edematous and erythematous, and there is a formation of bullae, and that bullae is going to be ruptured, okay, and it has a black center. There is a history of NHL, and for the same, patient is undergoing chemotherapy. So which of the following is the best treatment for the foot lesion? So given the history, it indicates the patient is immunocompromised, right? The patient is immunocompromised. Why? Because he is receiving chemotherapy for NHL. So indicating this, the skin lesion most commonly seen in immunocompromised is erythema gangrenosum. So most common cause of erythema gangrenosum is Pseudomonas. In the given option, see which of the following is given as anti-pseudomonal. There is only one option, that is ceftazidime. So the treatment is ceftazidime. That is answer is option D. Thank you. Stay tuned for the more in the Dr. SNK channel. Hello guys, welcome back to Dr. SNK channel. So today we are going to do the day 8 questionnaire, that is 30th March 2025. So it's a direct question. So there is a question as of follows, that it is asking the order of sequence that is done in RCT. What is RCT? It is randomized clinical trials, right? So what are the steps in an order? First is you're going to define inclusion and exclusion criteria, so which population to be taken. Then the second is randomization. You're going to randomize the patient. You're going to put some people in the drug group where you're going to give really the drugs, and others you're going to just give placebo. You're just going to give a placebo drug. Then third is blinding. You're going to blind single, double and triple. Single is just the patient, double is patient and doctor, triple is both with analyst. Okay, the last is statistical analysis, and you're going to produce the report. Okay, that is how it's done. Thank you. Stay tuned for more. Hello guys, welcome back to the Dr. SNK channel. So today we are going to discuss the day 9 MCQ, that is 31st March 2025. So what does it say? There is a study done, okay, there is some rapid study done for diagnosis of some viral infection. It is involving 200 people, right? So at the given cutoff, the test shows true negative as 70% and true positive as 65%. So the graph is given. The given graph you're going to detect first. So what is the given graph here? It is a ROC curve. It is a ROC curve. So if the given curve is ROC, what is it defined as? Receiver operating characteristics curve. So it is indicating the area under the curve. Okay, the area under the curve is, if it is more, it indicates good sensitivity and specificity. So in the given diagram, A is having the ideal or the best sensitivity, then B, then C, D, E, they are having bad. Why? Because they are downward curves. They are not giving good specificity and sensitivity. So in the given data, it is 75 and 65%. So they are not near to 100, 80 or 90. So you're going to take B as the ideal value. So here the B is the answer. Thank you. Stay tuned for more. Hello guys, welcome back to Dr. SNK channel. So today we are going to discuss the day 10 questionnaire, that is 1st April 2025, right? So reading the question, it is about the kappa statistics. Okay, it is regarding the kappa statistics. So there are two tests done to calculate this particular kappa statistics, that is USG and CT, right? So given these, these are the tests done for a disease of agreement, right? To assess the level of agreement, this particular kappa statistics is very much necessary. That's what you're going to remember, not more than that. There are two values, that is prevalence of observed and prevalence of expected. So in this kappa statistics, you're going to remember these two, PO and PE. What is PO? It is observed agreement between two tests. What is PE? we are going to expect it. One we have seen, that is observed. The one we are going to calculate, that is expected, right? So based on these we are going to derive so many calculations, so it may take 5 minutes for me to explain this particular question, so stay tuned and tight. So first formula is this particular kappa formula. What is kappa statistics? That is equal to P observed minus P expected divided by 1 minus P expected, right? Based on these results you are going to calculate the further things. Please pay attention. So first we are going to calculate this P observed. Okay, P observed. What is P observed? It is prevalence of observed. So basically in the given table you are going to take A, B, C, D. A, B, C, D. Okay, so substitute them. The formula for P observed, that is the observed things, A plus B divided by A plus B plus C plus D, right? This is the formula for P observed. We are going to calculate it. 80 plus 20 divided by 200, right? So 100, sorry, 80 plus 40 is 40. So 120 divided by 200. The value comes somewhere around 0.7. So we got P observed. Next we are going to calculate the P expected. But to calculate P expected, you are going to know the two preliminaries, that is prevalence of positivity rate plus prevalence of negativity rate. So this is the formula for P expected. Observed directly it is given, right? So there is nothing to calculate, whereas expected we are going to derive so many calculations. That's why you require more time. Now start doing it. Now first we are going to calculate positivity rate prevalence, right? So that is A plus B divided by A plus B plus C plus D, right, into A plus C divided by A plus B plus C plus D. Why I have taken A plus B only? Why I have taken A plus C only? Because we are asking positivity rate. So here the positivity rates are these, right? The positive things, the positive, remember the positive, right? A plus B, right? Both are positive, whereas in this A CT is positive for A plus C. Got it? That's why I have written like this, A plus B, right? What is A plus B now again? 80 plus 40 divided by 200 into A plus C. What is A? Again 80 plus 20 divided by 200. So calculate it. 120 divided by 200 into 100 divided by 200. So the value will get somewhere around 3 by 5 into 1 by 2, that is 0.3 I guess. Please verify once. It is 0.3. Yes, it's 0.3. Next we are going to calculate positivity prevalence of negativity rates, right? P neg, that is negative. Now we are going to take the negative things here, negative things. So what are the negative things here? USG negative is C, and USG negative again here it is D. Again CT negative B, C, USG and CT negative it is D. Got it? So write the formula. C plus D divided by A plus B plus C plus D into B plus D divided by A plus B plus C plus D, right? So now calculate. What is C value? What is C value? C value is 20, D value is 60, B value is 40. Remember it. Okay, C value is 20, D value is 60 divided by 200 into what is B value? 40 plus D value 60 divided by 200. Now calculate. 80 divided by 200 into 100 divided by 200. Again 1. The value comes somewhere around 0.2. Calculate it. It comes somewhere around 0.2. There will be calculator. Don't panic. Okay. So now we have got the P positive and P negative, right? So now substitute them. It is 0.3 plus 0.2. Now we have got the prevalence of expected agreement, that is 0.5, right? Lastly, now calculating the kappa statistics, that is PO minus PE divided by 1 minus PE. What is P observed. What is P observed? We have calculated it, right? We have calculated it. P observed is 0.7 minus P expected. P expected is 0.5 divided by 1 minus 0.5. So 0.2 divided by 0.5. So what is the value now? What is the value? What is the value? See the options: 0.4, 0.8, 0.6 and 0.5. 2 to the 10 to the power minus 1, 5 into 10 to the power minus 1. That's why how I do 0.420. So answer is 0.4. Okay, this is how we are going to derive. Thank you. Stay tuned for more on the channel of Dr. SNK. Hello guys, welcome back to the day 10 questionnaire. So it's a second question of today. Second question of 1st April 2025. What does it say? The following image represents the number of cases of osteoarthritis detected in the old age between April 1st to March 31st. So taking into the account of financial year. Here I have taken financial year as account, not Jan to December, right? I have taken from April to March 31st. How many cases would include to calculate the period of prevalence of osteoarthritis in this year? Okay, so this is what the INICET question, the previous INICET question. So coming into the concept per se, this is the model. Suppose this is April 1st, then this is March 31st. So this indicate 1 year. Got the concept? This is after March 31st. So this is before April 1st. So how many, what is meant by period of prevalence? Now that is important, right? What is period prevalence? What is period prevalence? Period prevalence is number of cases in the old plus current and new. Okay, these are all the things taken into account for period prevalence. If they ask total cases, simply just ask total cases, old plus new plus current, then future cases or the following cases. Okay, that is total case. Got the concept? Now we are going to substitute them. What is period prevalence now? What is period prevalence? Number of cases old, current and new. So what are the old cases? What are the old cases and new cases and the current cases? Taken into account, these are the old cases, right? These are the current cases, right? Then these are the future cases. Now do we need future case? No, right? So substitute them. So how many cases are there totally? 1, 2, 3, 4, 5, 6, 7. So the answer is 7 here. So what are the other options? You're going to rule out them. What is 4 basically now? It is the incidence of the current cases, right? That is between the year, right? That is after April 1st and before March 31st, those cases, right? Got it? Then what is 8? Simply total cases, right? Just count them: 1, 2, 3, 4, 5, 6, 7, 8, right? So that indicates just total cases, what I have told you. And last is 3, where you are going to see 3 cases. Here it is only 1, here it is 4, here it is 3. So this is the incidence of the new cases. What is incidence? It's the new cases in the last year, right? It is before April 1st. So after April 1st and before 31st, these are this year cases. These are the new cases of this year, suppose 2025. So the incidence in the 2025, it is 4. Got the concept? So the answer is 7 here. Thank you. Stay tuned for more. Hello guys, coming back to the last question of the today's, that is day 10, third question, right? 1st of April 2025. So what does it say? It's a Neet PYQ. It's a Neet PYQ. As I've told, 2 I have uploaded from INICET, 1 is from Neet today. So read the question properly. There is a researcher, he is conducting a study. What type of study it is? It's a cohort study. So to find association between HCC and HCV virus, right? While considering the disadvantages of the cohort study, which of the following is least relevant to this study? So all of the given down things are the biases, right? What is Hawthorne biases, what is attrition biases, Parkinsonian bias, confounding bias, all those things are important now. So what is Hawthorne bias, attrition bias, and Parkinsonian bias and confounding bias? So confounding bias is multifactorial. So of course cohort will take it into account, right? Cohort study is also important to account these multifactorial factors. So of course this option is correct, right? Whereas the Hawthorne bias, attrition bias is loss of follow-up. The patient will undergo loss of follow-up, whereas Hawthorne effect is this particular patient is going to tell false things. Okay, he is going to just give false opinions or the false things related to the study. Even if he is doing, he will change his behavior, and so that to accommodate it as a good attempt, to take it into good attempt, to behave like a good person, the patient will tell so many lies, and that type of bias is Hawthorne effect. Whereas Parkinsonian bias, what is it? It is based on the hospital patients taken as controls, right? Hospital patients taken as controls. That is least to do with this. Why? Because this is done in case control study, not in cohort study. Okay, it's a repeat MCQ. Please make sure you're going to not make it wrong in your final exams. Please stay tuned for the more in Dr. SNK channel. Thank you so much.